Hello everyone, this is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss abortions. So if you haven't liked, please do like, share and subscribe. So what is an abortion? An abortion is the medical process of ending a pregnancy so that it does not result in the birth of the child. And there are mainly two types of abortion. That is spontaneous abortion, which can include these other types of abortion or induced abortion. So today in this lesson, we are going to concentrate more on spontaneous abortion, which is what we refer to as a miscarriage. So coming to a miscarriage, which is also known as a spontaneous abortion, this is a natural loss of a pregnancy before the 20th week of gestation. And as you may be aware, most miscarriages occur in the first trimester, that is before 12 weeks. So it is a relatively common experience, and studies have shown that about 10 to 20% of non-pregnancies may end in miscarriage. So there are various causes of miscarriage, as you may be aware, and the causes can include genetic causes, hormonal imbalances, uterine or cervical issues, and then we'll look at these causes in details one by one. So we'll start with genetic causes. So mostly this will encompass chromosomal abnormalities, which will account for about 50% of first trimester miscarriages. And then examples of these chromosomal abnormalities, we can have examples such as trisomy or Down syndrome, monosomy, such as the Turner syndrome, or even a molar pregnancy. So that's that on genetic causes. Coming to hormonal imbalances, we can have low levels of progesterone or other hormones which can hinder pregnancy development. So what are the uterine or cervical issues? So we can have uterine malformations, we can have fibroids, we can have cervical insufficiency, for instance, where there is a weak cervix and then it opens too early, leading to an abortion. We can also have maternal health conditions such as uncontrolled diabetes, thyroid disorders, autoimmune diseases, infections such as rubella, polycystic ovarian syndrome, also causing abortions. And then we can also have things such as lifestyle and environmental factors, such as smoking, alcohol or drug use, or exposure to toxins or high caffeine intake, leading to abortions. And sometimes age is also a contributing factor. For instance, the risk will increase with maternal age. So if you are 45 plus, you have 80% chance of experiencing a miscarriage. So what are the types of miscarriage? The types include threatened. So for threatened miscarriage, this is where there is vaginal bleeding with a closed cervix, and in this case, pregnancy may still continue. We can have inevitable miscarriage, where there is bleeding with an open cervix, and then miscarriage is imminent in this case. We have incomplete miscarriage, where some products of conception remain in the uterus. We have complete, where all pregnancy tissue has passed and the uterus is empty. We also have missed miscarriage, where the fetus has died, but there are no symptoms discovered via ultrasound. You can have recurrent, where there's 3 or more consecutive miscarriages, and you can also have septic miscarriage, where there is uterine infection involvement. So what are the signs and symptoms? So there is usually vaginal bleeding, which can be light spotting to heavy bleeding. You can have cramping or pain in the lower abdomen or back. You can have passing of tissue or clots from the vagina. We can have sudden disappearance of pregnancy symptoms such as nausea or breast tenderness. So in terms of diagnosis, A pelvic examination can be performed to check if the cervix is open or closed. An ultrasound can be carried out to check fetal heartbeat and development. And even other blood tests can be done, such as checking for the levels of HCG or So in terms of management, how do you manage a miscarriage? So you can have expectant or the natural management, where you just let the body expel pregnancy tissue naturally, and then this is suitable for incomplete or missed miscarriage where there are no complications. So this might take days to weeks, and then after that you have to follow up an ultrasound to confirm complete expulsion. And then you can also have medical management, where there is use of medications such as misoprostol to expel tissue and to reduce the waiting time, and in case there is need for surgery. And then you can also perform surgery, where you do things such as the manual vacuum aspiration or the D&C to remove the tissue, and this is mostly indicated where there is heavy bleeding, there is signs of infection, there is retained tissue, or just a patient preference. And then there are also preventive measures, where you have to early and regular prenatal care, especially after you find out that you're pregnant. And then you can also manage a healthy lifestyle, manage chronic conditions that we've talked about, such as diabetes, taking some vitamins and folic acids, and you have to avoid non-infections and toxins. So in that way you'll be able to achieve a healthy body suitable for pregnancy. Thank you so much for listening, and hope to see you in the next video. Thank you.